On Primetime Politics tonight, new concerns about a new variant. The Trudeau government imposes a travel ban on some countries as a new COVID-19 variant is identified in South Africa. We'll look at the political reaction and talk to an infectious disease specialist about what we actually know about the variant. The Ontario government and Ottawa are still negotiating a $10 billion deal for $10 a day childcare. We'll hear from the federal minister, Karina Gould, on where things stand. And our journalist panel will look at the first week of Parliament and the political reaction to the new COVID variant. And we start with a new strain of the coronavirus, which is causing rapidly growing concern around the world. The variant has been identified by South African researchers as that country is experiencing a dramatic surge in infections. The World Health Organization is still conducting research, but South African doctors say the variant is displaying a higher infectiousness than previous variants. About a dozen countries, including the UK, have already banned flights from countries in southern Africa. Ontario Premier Doug Ford on Friday called for a similar travel ban in Parliament in Ottawa. The Conservative opposition echoed that call. And by mid-afternoon, Federal Health Minister Jean-Yves Duclos was announcing a travel ban for foreign nationals and quarantine measure for Canadians arriving from 7 countries in southern Africa. Those countries are South Africa, Mozambique, Botswana, Namibia, Zimbabwe, Lesotho, and Eswatini.
For foreign nationals, they will not be able to come into Canada if they have traveled or spent time in the last 14 days in southern Africa. For Canadians, if they have already entered into Canada, we ask them to isolate themselves now, to quarantine if they have spent time in the last 14 days in Southern Africa, to be tested and to exit their quarantine only, obviously, if their test is negative. The second thing we're asking them to do, if they are planning to come back to Canada, is to be tested at their last airport transit point. We also are going to asking them to, when they come through an entry point, to be tested, to wait for their negative test to be shown, and then to go to an appropriate quarantine place, to stay in quarantine for 14 days, and to be tested a second time at a further date. And finally, Global Affairs Canada is asking all Canadians to refrain from traveling to southern Africa.
Joining me now to look at what we know and what we don't yet know about the new variant is Dr. Lisa Barrett. She's an infectious disease specialist and a clinician at the Dalhousie University Department of Medicine. Dr. Barrett, first of all, thanks for joining us.
Good afternoon.
What do we know about the variant? And as I say, I won't say what do we not know, but what are we still learning about it?
Yep, well, it's definitely still a COVID virus and therefore something to be respected well. This is a recently identified version of the virus, although not yesterday or the day before. It's been around for a little while and it's been on the radar for a little bit. It has been raised to a level of a variant of concern by the WHO, and that means that there is enough both science information about the mutation type and about the way it seems to be spreading for there to be concern about increased transmission and or potential for affecting vaccine effectiveness. So that's what we know so far, but there is a lot we don't know yet, and we really do need to be cautious about jumping to conclusions about it.
Okay, let's talk about one thing. You mentioned the mutations. It said that it's got at least 30 mutations in terms of its spike protein and all that. Does that lead us to any conclusions that it might or might not be harder to combat or might not be harder to identify or identify for vaccines?
So a little bit of both. Anytime you see a lot of mutation in a virus, clearly viruses are trying to move away from the pressure of your immune system and of vaccines all the time. That's what they do for a living. And when you see 30 mutations within a very important part of the virus that helps it attach and spread, then that's always a cause for concern, both for spreadability and for vaccines, because spike protein is the target for vaccines. So that is of some concern. There are about 20 other mutations, 50 in total, throughout different parts of the virus. And what that tells us as well is that this virus has had a chance to move and grow and to move away from its parent viruses. Do we know exactly what that means yet? Not entirely, but good to be aware and very, very careful about how we treat it at this point without panicking too much, I think.
Some of these South African doctors and researchers are saying that it seems to be very transmissible. Its R number is very high. Do we know that yet, or is that something that will still come with the weeks and weeks of observing?
That's something that we're going to have to get from two different streams of investigation, at least. One of them is in the lab, where we look at how easily this new virus can grow, how quickly it grows, and how easily it spreads from cell to cell in the actual test tube. But importantly, we also need to know how it spreads in people in the communities. And that's where the epidemiologic information from places where they have cases will be exceptionally important. And to get that information and data, we'll be relying on people, for example, in one of the countries where it was identified, just above 100 cases in South Africa. And we also need to know, and I want to be clear on this, we will also want to know how many folks there are vaccinated and what other public health measures they have, because that affects the effective value of how transmissible a virus is, and that's important information for us to have.
Okay, I want to ask a big question for all of us when we watch this. I mean, there's potentially worrisome development. When the Delta virus, or the Delta variant, first came out, doctors and international researchers immediately set about testing the different vaccines' effectiveness or efficacy faced with the new virus, the Delta variant at that time. How long was it before they started to get results and started to make some conclusions about how effective the vaccines were against that new variant?
Well, it can be done fairly quickly if it grows well in the lab within the companies and within different scientific and research labs around the world. I know the UK has already started, and the network of individuals that work with the WHO are already assessing the effectiveness against the antibodies that develop to vaccines. So that part will be a little swifter, maybe even within a number of weeks. What is also important is to look at, again, in countries where their vaccination rates are fairly high, whether or not there are people that actually are still getting infected or reinfected. And that is something that we're going to have to keep an eye on as we go forward, even for people who've been naturally infected as well.
One of the things that has come out of this, and several people have underlined this, and that is that this once again gets back to the issue of vaccine equity. As long as there are pools of countries where there are very low vaccination rates, and you've alluded to it, that shows the need for equity to vaccinate the whole world, because there will be pools of development of these new variants. Is this a perfect illustration of that?
I think this is a really good time to point out two things. One, to your point, sometimes we get a little caught up on who needs this third dose or booster dose for full protection, and not everyone does. And we do have a bit of a supply problem in the world, but also we have a problem in some countries with health systems not being sufficient to get vaccines out. And we really should be advocating for and actively helping with rollout in these countries. But the second part of this variant of concern, and I hope people take note of this before the holidays, is that we aren't done with this pandemic yet. We really do need to be mindful of the fact we're still in a pandemic as we head into a holiday season through December. And please, I'm hoping that people are okay keeping some border measures in place like testing, as well as some public health measures to help keep us safe, along with identifying virus as it may come into our country. It's going to be really important to remember that over the next holidays, and hopefully both worldwide equity and a little caution in our own country are two things that we can hold on to over the next number of months.
Okay, Dr. Barrett, thank you very much. A pleasure as always.
Thank you.
We turn now to Ontario, where literally millions of parents are waiting to see when more affordable childcare might be coming to their province. 9 provinces and territories have signed on to Ottawa's $30 billion affordable childcare program, which will cut childcare fees in half by next year and eventually to $10 a day. But Ontario and New Brunswick are still holdouts, along with Nunavut and the Northwest Territories. Ontario Premier Doug Ford says Ottawa's offer of more than $10 billion would shortchange Ontario. Joining me now is the Minister responsible for Ottawa's Child Care Program, the Minister of Families, Children and Social Development, Karina Gould. Minister Gould, thanks for joining us.
Glad to be here.
Okay, well, let's start with, this child care program is massive, a $30 billion program, but let's start with a holdout, Ontario, which accounts for almost 40% of the nation's children under 12. How would you describe where things are at now in the negotiations with Ontario?
Well, look, we are delighted that Ontario has come to the table. Officials are having very detailed conversations at this point, and so I think this is a good start. And we are eager to continue these conversations so that we can deliver affordable, quality, inclusive childcare for families in Ontario.
Okay, you have heard, much has been said in the public place, and you've heard Premier Ford and several of his ministers repeatedly say that what they have heard from Ottawa so far, the offer of $10.28 billion in funding over 5 years for Ontario. They say it shortchanges Ontario, that it doesn't take into account Ontario's contribution to childcare through $3.6 billion of annual spending on junior kindergarten for 4- and 5-year-olds. How do you respond to that?
Well, first of all, $10.28 billion is a lot of money that could go a long way to helping families in Ontario make childcare more affordable. You know, we just saw an agreement with Alberta that is going to see Alberta families see a 50% reduction in fees as of January 1st, 2022. We could see the same thing for families in Ontario, but you know that is something that we at the federal level are working towards. And the other thing that I would say is we absolutely, recognize and commend Ontario for the great work that they do in full-day kindergarten. But this funding is about reducing childcare fees for existing spaces as well as growing spaces so that every family who wants to put their child in childcare can do so.
So you have been quoted as saying that this is just on a per capita basis, and that's why you get the figure of $10.28 billion. But Ontario says that, no, there were exceptions made in Quebec's case, for example. Quebec has a very, very extensive program, and so other criteria were used for Quebec. They say Ontario has got the most extensive junior kindergarten program, as I mentioned, and $3.6 billion worth of spending. That exceptions should be made. You say that's not negotiable.
Well, if Ontario were to reach, $8.50 childcare a day, just like they have in Quebec and have had for almost 25 years, then yes, we would be having a different conversation with Ontario. But in Ontario, families pay on average, between $1,500 and $2,000 a month for childcare. So there's still quite a bit of work to do in Ontario. They're frankly apples and oranges when it comes to affordable daycare in both provinces. And full-day kindergarten is absolutely fantastic. And as I said, we recognize it. We applaud Ontario. It is an excellent model. It's not childcare in the sense that we're talking about it.
Okay, sustainability, and I found this a very interesting point because having watched what's happened in healthcare where the federal participation has declined its proportion of federal funding. Sustainability, Premier Ford says he's worried that this is only a 5-year program. When the program expires, he says the level of federal funding could decline, and then the provinces would be on the hook. They'd have to either cut back on the access or increase childcare fees. What guarantee do you have that this program will be sustainable and the funding will be adequate after the 5-year agreement?
Well, first of all, Martin, we have negotiated agreements with 9 provinces and territories, and no other province or territory has raised this as an issue because it's actually very common for the federal government to negotiate 5-year agreements and then renegotiate because things change over the course of those 5 years. And the other thing that I would just make mention, because I think it's really important that that's on the table and clear for the minds of Canadians, and particularly those in Ontario, is that while this is a $27.2 billion program for the provinces and territories over the next 5 years, the Finance Minister in Budget 2021 earmarked an additional $9.2 billion on a yearly basis, on an ongoing basis, into the fiscal framework. So there is money already set aside in future years. So it's not really a valid argument in this sense because the federal government has already booked that money on a go-forward basis.
So you're saying that the provinces can count on a total nationally of $9.2 billion every year ongoing after this 5-year program has been announced.
And it's actually worded as a minimum of. So it's a recognition that there is an ongoing commitment from the federal government, recognizing that this is something that we value for all Canadians, right? And so Minister Freeland was very deliberate in making sure that that continued beyond year 5. And the other thing that I would say, too, is that I will also be coming forward with legislation to ensure that it is not only, booked into the fiscal framework, but it's also legislated. So provinces can rest assured that the federal government will be there on an ongoing basis. Okay, a word about New Brunswick, because New Brunswick still has not signed a full agreement. They signed a partial agreement, but it's not the full childcare agreement that we're talking about here. They're still, if you want to call it a holdout. Where do things stand with New Brunswick? We are having excellent conversations with New Brunswick. In fact, I feel very confident that we are going to reach an agreement quite soon with New Brunswick. And so those conversations continue, but we're in a very good place, I think, with them. Okay, for at every signing ceremony, and your predecessor, Jean-Yves Duclos, was at most of the signings. You were in the Alberta one. At every signing ceremony, it's stressed that this will lead to, by next year, 50% reduction in childcare fees. It will lead to more positions created, and eventually you're hoping it will lead to $10 a day daycare. I guess one question for parents is, when will federal funds first flow? When will the money first start flowing to the provinces so that you can see reductions in fees? So for most agreements, it's within 60 days of signing the agreement. So for example, in Alberta, it was announced when we signed the agreement that Alberta will be reducing fees for families in Alberta in a regulated care space by 50% as of January 1st, 2022. Last week, Saskatchewan announced that they were retroactively reducing fees for parents by about 50% going back to July 1st of this year. Newfoundland is going to see reductions as well next year. So there's lots, all of these provinces are working this through, but the agreements require that provinces reduce fees by 50% by the end of 2022. Okay, so that's actually spelled out in the agreement. What about the $10 a day stipulation? I mean, the goal is eventually to $10 a day daycare. Is that stipulated and that's signed on in each agreement? Yes, it is, within 5 years of signing the agreement. Okay. A question about basically, I'm wondering about availability, because there's also a commitment to create new positions. Who monitors all this? I mean, the federal government has handed all of this over. They've signed on to a 50% reduction and then a $10 a day eventually. But how about the number? Because it's estimated that the incredible number of spaces are required. How is that monitored? Mm-hmm. So each province as well commits to the number of new spaces that they're going to create over the next 5 years. And this is something that has to be submitted to the federal government, quote unquote, action plan as to how they're going to meet the objectives that we're putting out. So a 50% reduction in fees in year 1, getting to a reduction of $10 a day on average by year 5, creating the number of spaces to get to the number of coverage so that families that want to put their children in childcare will have that option, as well as increasing and supporting early learning and childcare workers, because we know we're not going to be able to create the spaces if we don't have, the workforce that we need to do that. And so all of that is negotiated and agreed to between the provincial and federal government, and we'll have regular reporting from the provinces and territories on their milestones, and also ongoing dialogue and conversation to see how they're doing, because ultimately we want to support the provinces and territories to be successful, because we want families across the country to be able to access this, what I think is a really transformational program. Okay, I guess that is the last question, though. I mean, it's almost about enforcement. What happens if a province says, look, we just can't do this? We can't reach X, Y, or Z goal? Well, the federal government could retain the funding depending on the situation. I mean, I think first and foremost, we want to have a dialogue and maintain that open conversation to see what the challenges are, and maybe if we're able to help and kind of figure out how we can move forward. But there is that clear accountability in terms of what the province has agreed to that is contingent on the federal government sending funds. Okay, Minister Gould, I thank you very much. We'll look forward to speaking with you as this evolves and as those 2 other provinces and 2 territories sign on. Absolutely. Thank you. Well, joining me now to look at the first week of the new Parliament are 2 members of the Parliamentary Press Gallery. Marieke Walsh is a parliamentary reporter for the Globe and Mail, and Janet Silver is a managing editor with iPolitics. Both of you, thanks for taking the time. Welcome to the show.
Thank you.
Thanks for having us.
Okay, let's start with a story which really at the week's end is now resonating through Parliament, across the country, around the world. And that's the growing concern about this new variant that has been identified in South Africa. Marieke, you're following this story. You're filing on it today. Ontario Premier Doug Ford was the first one of the first politicians I know of to raise the call for a travel ban. Trudeau government imposed travel bans and quarantine measures within hours. What do you make of the response? What do you make of the issue?
Well, I don't think they did it just because Ontario Premier Doug Ford called for it, but certainly he was early out of the gate this morning, along with Conservative leader Erin O'Toole and Alberta's Premier Jason Kenney, urging action swiftly rather than the slower pace we've seen in responses in the last year and a half from this government. Do that in line with many other European countries, now also with the United States, to try and at least slow the pace or delay the arrival of this variant in Canada. We'll have to see how it goes. It certainly is a reminder that we are not out of this, that this is still a really serious concern. And I think it's a reminder that this is going to be in some ways the new normal, at least for the next little bit soon.
Janet, and Marieke refers to it, or alludes to it. It is interesting that the response across the world, but here in Canada too, was very quick. I guess an abundance of caution, as they say, on how this unfolded. In a way, it made it less of a political story, less of a days and days of the opposition saying you've got to do this and the government being accused of not acting.
Absolutely. And it was interesting in that press conference earlier, Canada's Chief Medical Health Officer, Dr. Theresa Tam, said, look, we know very little about this variant. And that's what the scientists in South Africa are saying. And as you mentioned in the intro, Martin, in terms of how much those numbers have been going up in South Africa. So I think it's prudent upon the government that they do have to act very quickly, given they don't have a lot of specifics on this variant, how serious it is. They know that it's catching very quickly, but they don't know how vaccines at present compare with this new variant.
It's interesting. Jean-Yves Duclos, the new health minister, used a term which we often hear, but it's quite an interesting one. He called it a belt and suspenders approach. You want to have all the precautions, so if your belt doesn't work, your suspenders work. Marieke, in terms of the political environment in which this evolves, any comments?
This is going to be something that the government still has to manage, right? Because Canadians are fully vaccinated in many respects, and they want to get back to their lives. So it's also going to be more challenging. This is, as the minister said on Friday, this is affecting a small number of people daily. I believe they said 15 or 50 people. So it's less than 100 daily that they're expecting this impact. And depending on how this variant goes, it could be many more depending on which country it goes to. So there's going to be, I think, more challenges keeping the public on board as new measures are rolled out, because I think that Canadians were looking forward to putting some of this behind them. And it's going to be a question of how quickly the government continues to respond. Certainly, I don't think it's going to be an easy winter.
Mm-hmm. I'll throw something else out there. When it came to banning flights from India and Pakistan, in Canada, the diaspora, or the number of people with relatives and business and connections to those two countries, it is quite large. Whereas this, as Marieke mentions, is a very small number. At least now, there's no direct connections by flights, and there's a very small number of people with any association with those countries. Does that make it Janet, does that make it politically much easier to do?
A little bit. They'd also said earlier that they had found cases in Hong Kong and Belgium and in Israel as well. Okay. But I think getting back to the point in terms of, look, this has been a political from the get-go. Their delay in banning flights in previous countries, as you just mentioned, Martin, I don't think they could rest on their laurels at this point at all. And this at the same week that they're just rolling out vaccinations for those ages 5 to 11. And in this country, that has been the biggest increase in terms of COVID cases. I think they realized, they looked at the tea leaves and said, yeah, we've got to move on this. They were getting pressure from the opposition earlier this morning with the WHO emergency meeting. There was nothing, they had to move very quickly because, as Marieke was saying earlier, people do want to get back to a bit of normalcy. We've had the House of Commons resuming this week. But you can't do that if we're going to have a fifth wave with another variant that who knows how serious this one could be. And given that we're doubly vaxxed, whether or not that's going to be enough.
Okay, well, you segue perfectly into the other big topic this week. The opening of Parliament, the first week of this new Parliament, was sort of overshadowed by both parliamentary business, but also a business of how to get back to business. We saw the vote last night, Thursday night, on hybrid sittings. So now some MPs and ministers will be allowed to continue to participate remotely. The Tories and the Bloc Québécois vociferously opposed that, but it passed with the support of the Liberals and the NDP. There was that debate, and there was also the debate about vaccination and the fact that we still don't know how many Tory MPs have availed themselves of a medical exemption for vaccinated. So how many are not vaccinated? Yeah.
Well, it's the House of Commons that decided not to release that information on the numbers from each caucus of who has medical exemptions. So the Tories, I think, have a bit of cover on that because the Liberals and the NDP and the Bloc are all on the Board of Internal Economy that controls the House. And so if they want to go down that route, they still have other options to try and push that envelope. But I think that's really an Ottawa bubble issue now. When you look at the issues that the opposition was driving in the House of Commons in the first week, it was all about the economy, inflation, the issues with softwood lumber, the issues with the U.S. and the fact that they have not been able to get a deal despite sending this whole full court press of ministers down to Washington the week before on zero emissions vehicles, and inflation, and the list goes on. So yes, there are these questions about hybrid parliament, vaccinations. Those are things that I think matter to the Ottawa bubble, but they are not what matters to the average person. And when we see these pressures on cost of living and affordability, I think that really is what is going to be driving the issues in Parliament in this fall session. And I think that's really where we see the opposition driving the government and pushing the government. Okay,
Janet, reflections on this first week, because I say there were so many things going on at so many different levels. Your reflections on this first week of the Parliament.
Well, just picking up what Marieke was saying just a moment ago, it was interesting on Tuesday, Blake Richards from the Conservatives put in a point of privilege to the Speaker of the House with regards to vaccinations and the board and whether or not they had the right to be able to do that. So that issue will bubble along because the Speaker has to make a ruling. We don't know when that's going to be on that issue. And also as part of that whole hybrid sitting debate, there was a lot of references in terms of there's no guarantee that people are 100% safe, even if they are doubly vaccinated. The Liberals were pointing to the Conservative member of Parliament from Quebec who has COVID. So there was, I hate the word politicization, I can't even say that correctly, but with regards to vaccinations in the House and using that as a way forward. For the NDP, they wanted the hybrid sitting, of course, so that they thought they were arguing that it would bring in more people to the House. So it's been a real interesting debate. But like Marieke said, that's a real inside the bubble, because if you're sitting in Nova Scotia or particularly in British Columbia this week, that's not on your radar.
Yeah. Just a last question, though, as journalists, one of the accusations was that with this hybrid sitting, we won't see ministers anymore. They'll be back onto their Zoom screens and not in the House of Commons. Any thoughts on that?
Yeah, I mean, it's not as though the opposition had no legitimate pushback for the reasons why they didn't want a hybrid parliament. There are clear reasons on both sides of the debate for having a hybrid parliament. We see this with the Conservative MP who does unfortunately have COVID, as Janet mentioned. But there are accountability issues that do come from a hybrid parliament. We saw this week for the first time in a meaningful way scrums and accountability questions from journalists very easily put to ministers because they were right there. That hasn't been happening in the last 19 months, and it does hurt journalists' ability to get answers for Canadians and to hold the government accountable for them. In a similar way, if a minister is under fire and chooses to answer the questions from Zoom, it's a less stressful situation than being in the House of Commons and feeling the heat from the opposition and then also having to face journalists.
On that note, we're going to have to wrap it up, but hopefully we will still continue to be able to put the heat to them. Thank you very much, both of you, for taking part. Have a great weekend.
Thank you, Martin, for having us.
Well, that's all for this edition of Primetime Politics. I'm Martin Stringer. Thanks for watching, and have a great weekend.